Before I start my presentation, I'm going to show you the IV room of a hospital pharmacy. I am going to be doing my demonstration speech on how to make an IV. This is where all of the IV meds are kept. This is called the anteroom. The spot where the medications are made is actually called the IV room, and there are two hoods in the IV room. Hoods are a place where IV medication is made. This has a sterile airflow coming out of it, and all of the medications are kept sterile while making an IV process. Hi, my name is Megan Sports, and today I'm going to demonstrate the process on how to make an IV medication. One thing you will need to do when working in a hospital pharmacy is you will need to know how to make an IV. There are many patients in the hospital that will require a medication through an IV bag. I learned how to make an IV medication when I was in college in 2008, completing my pharmacy technician degree. So the first thing you will need to do is make sure that you have on scrubs, because you cannot enter the IV room without the proper apparel. After you have scrubs on, you need to make sure that you put on a hat and booties. And make sure that all of your hair is the hat so that nothing is exposed, so that nothing will contaminate your compounding materials. Next, you will need to grab booties. And make sure that the booties cover your entire shoe so that no dirt and debris or other germs enters the IV room and contaminates your medication. After you have on your booties, you need to wash your hands for 20 seconds with soap and water. It is important to get off any visible dirt or debris and make sure that you take off all of your jewelry and do not be wearing any nail polish. After you've washed your hands with warm water for 20 seconds, you need to dry them thoroughly. Once your hands are dry, then you can put on your gloves. And after your gloves are on, then you can find your IV medication label. Okay, my label is for vancomycin 1100 milligrams. So what I'll need to do now is grab the vancomycin, which is kept in the fridge, and grab a sodium chloride 250 milliliter bag, because that's what the vancomycin will go in. Attach my label to the bag. And now you're finally ready to enter the IV room. Before you can make your IV medication, you need to make sure that the area that you will be making the medication in is clean. So I just grab a sanitary cloth and wipe off the wall of the hood from the back to the front, and then flip it over, use the other side, and wipe the surface of the hood from the back to the front to make sure that all the germs exit the area and everything is sanitized. Now you can finally start with making your med. First, you can hang up your bag, set up your vial, and grab the correct size needle that you will need for the amount of drug that you're going to put in. My label is asking for 1100 milligrams, and since the concentration of my vancomycin antibiotic is 100 milligrams per milliliter of drug, I will use a syringe that can hold a total of 12 milliliters. After I find my correct size syringe, I will attach my needle, throw away my garbage, take Take off the cap of the needle, poke it into the vial, and pull back on the plunger of the syringe until you get the total amount that you need. Make sure there's no bubbles in the syringe, and you can tap the side of the vial if there is. After you have your 11 milliliters, you can put it in the bag which the patient will receive and push the plunger in so that all of the vancomycin goes in the bag. Throw away your needle in the sharps container, and you can basically just put your stuff back in the bin so that it can go up to the patient. Now, after you've completed the simple steps of garbing up, washing your hands, finding your label, finding your medication, cleaning your hood, and finding the correct syringe, catching the needle, putting the medication in the IV bag, and then you have finally learned how to make an IV medication.